How is dissociative PTSD different from other types? Imagine feeling like you're watching your life from outside your body, or that the world around you is just a faint, unreal version of reality. These are common experiences for people with dissociative post-traumatic stress disorder. Unlike typical PTSD, which mainly involves intrusive memories and hyperarousal, dissociative PTSD includes these unique feelings of detachment and unreality. It's a way the mind tries to protect itself from overwhelming trauma by creating a sense of distance from both the self and the environment. In standard PTSD, people often re-experience trauma through flashbacks or intrusive thoughts and remain emotionally connected to their memories. They might avoid reminders but still feel like they are part of their experiences. With dissociative PTSD, the person might feel like they are outside their own body or that the world is foggy or dreamlike. These dissociative symptoms can make it harder to stay grounded in reality and can interfere with daily functioning. Research shows that about 15 to 30% of those with PTSD experience dissociative symptoms. This suggests it is a significant subtype rather than a rare variation. The dissociative features are thought to be a protective response, helping the brain cope with trauma by disconnecting from painful feelings or memories. When comparing dissociative PTSD to complex PTSD, which develops from prolonged trauma like childhood abuse or ongoing violence, the main difference is that complex PTSD involves broader issues like emotional regulation problems, negative self-view, and relationship difficulties. Dissociative PTSD focuses mainly on the dissociation symptoms, while complex PTSD includes a wider range of emotional and interpersonal challenges. It's also important to distinguish dissociative PTSD from primary dissociative disorders such as dissociative identity disorder or depersonalization disorder. In dissociative PTSD, dissociative symptoms happen alongside other PTSD symptoms like flashbacks and hyperarousal. In primary dissociative disorders, dissociation is the main feature, often involving identity changes or memory gaps without necessarily meeting PTSD criteria. Clinically, individuals with dissociative PTSD often have a history of repeated trauma, sometimes starting in childhood. They may also have other mental health issues like phobias or personality disorders. These symptoms can cause significant impairment in daily life and increase risks like suicidal thoughts or behaviors. Both men and women can develop dissociative PTSD, but research indicates it might be slightly more common in men. The way people experience dissociative PTSD can be quite different from other types. They might describe feeling like they are watching themselves from outside, or that their surroundings are dull or distorted. They often feel emotionally numb or disconnected from their senses. This contrasts with standard PTSD, where individuals are usually aware of their feelings and surroundings, even if they try to avoid them. Treating dissociative PTSD requires careful planning. While trauma-focused therapies work well for many PTSD cases, dissociative symptoms can interfere with processing memories. Therapists often need to address dissociation directly, helping individuals develop skills to stay grounded and connected to reality. Medication can also be part of treatment to manage symptoms, but therapy remains the main approach. It's important to remember that dissociation is a common response to trauma. It can serve as a protective mechanism but can also become a barrier to recovery if it persists. Recognizing dissociative symptoms can help clinicians tailor treatment plans that address both the core PTSD symptoms and the dissociative features. In summary, dissociative PTSD is a distinct subtype characterized by feelings of detachment from oneself and the world, alongside typical PTSD symptoms. It often results from repeated or severe trauma and can make recovery more complex. If you or someone you know experiences these symptoms, consulting a mental health professional is essential for proper diagnosis and personalized treatment. Always seek guidance from healthcare providers to ensure safe and effective care.